class. And what else does your brain do? Processes information. It processes information about vision, so everybody here is you can see things, and hearing, everything you can hear. So who here knows one of the cells, the major cell that's in the brain? What do we call the little microscopic cell that makes up the brain? Neuron. All right, here's the million-dollar question. How many neurons do you have? A lot. Billions. All right, let's get a figure. How many billions? 100,000. 5 billion. Trillion. So you have 100 billion neurons in the brain. So if you were to count them one at a time and you did one cell per second, it would take you close to 4,000 years to count all the cells in the brain. Now, how do those neurons work? So how do you go from a neuron to everything you just said? Moving, hearing, seeing, feeling. They're all connected. So all the neurons talk to each other. And the trick to a neuron is they have one arm going out to tell the world what they think, but they have thousands of receivers to hear what's going on. And every neuron takes a vote. Let me give you an example. So let's say you have to decide, you're the neuron that has to decide if you're going to lift up your thumb. That's your whole job in life, lifting up the thumb. And you have to decide, do I lift up my thumb or not? The way you decide it is by taking a vote. And every neuron here gets to place a vote. And you get to count the votes. So how many people here think this neuron should make the thumb go up? Raise your hands. So be watching. All right. How many people here think we should keep the thumb down? Raise your hands. Do you know who had more votes? Yeah. No, it's tough. I think it was down. So you would take that vote and you would decide, keep the thumb down. And all the neurons connect between all the other neurons. So if there's 100 billion neurons, how many connections are there? A lot. It's actually a number called 1 quadrillion connections. And all of those connections are what make up your decisions. Now, if you put all those neurons together and all of those connections together, you get the human brain. So who wants to see the human brain? All right. So that's what we have here. This is a human brain. All right. This is an actual human brain. So let me tell you what you're looking at, and then we're going to get you a close-up for everything. So first off, sometimes we get asked, where did this come from? And it was the last student who didn't listen to Miss Walsh. Okay, so this is what happens. You end up being a brain. I'm just kidding. So sometimes when people pass away in the community, they donate their bodies to science. It's a gift that they give to the medical school. So medical students and doctors and surgeons and nurses can learn about the human body. And it's a wonderful gift they give. It's like organ donation. And so we have a lab where we retrieve the brains from somebody who has donated them to science so we can come and teach people about the brain. So this is a real brain from a real human being who wanted you and a lot of other people to be able to learn. And so if you look from the side, if you guys can see this, can you see all the dark lines on the top from where you are? Kind of purplish. Those are all veins. Those are all blood vessels that are either bringing blood to the brain or taking it away. This, facing you, is the front of the brain. So if this was in my skull, it'd be sitting just like this. Is it freaking you out? Just a little bit? All right. So your eyeballs would be right about here. This would be the top. And then this would be the back of the brain. Now, the brain is organized into different jobs. Each part of the brain does something very different. And we give all the different parts names. I'm going to tell you a couple of the names, and we'll go through what the differences are. So we're not very creative sometimes. What do we call, there are 4 lobes to the brain, 4 parts. What do we call the part in front? Frontal lobe. See, that's the easy one, the frontal lobe. The side over here is called the parietal lobe. The very back is the occipital. And this little piece here in the corner, that's the temporal lobe. So 4 lobes to the brain: frontal, parietal, occipital, and temporal. And they all do something very different. So we're going to play a little game and sort this out. I need a volunteer. All right, you young men. So here's what I want you to do. I want you, and I'm going to need a second volunteer. All right, you young ladies, so stand up. I'm going to give you each a task. Okay, I want you to listen carefully and do the task. You are each going to say the same 4 words, but I want you to say them differently. So here are the 4 words. You are, 5 words. You are going, 6 words. You are going to the store. Okay? Now I want you to say that sentence as if you're giving a command to somebody. How would you say it if you're giving a command? You are going to the store. Good. Perfect. Now, I want you to say those same words, but ask them a question. Same words. You are not going to the store? Does everybody hear the difference between those two? So now I want you to say it again, just like you did. You are going to the store. Was that a command or a question? Command. All right, your turn. You are going to the store? What was that? But it's the same words in the same order. How did you tell the difference? Tone. So, for length, guys, you did a great job. You can sit down. This front part of the brain on the left is what they used to say those words in the sentence. But on the other side, on the right side towards the front, is what they use to modulate their tone. It's what they use to modulate their pitch. Same words in the same sentence. Now, for you guys who are in the audience, what sense were you using as they were speaking? Hearing. Now, you have parts to your hearing. You had to hear the words. You had to have those sound waves hit your brain, and you had to know that it was English, and you had to know what the words meant. And that was here on the left, towards the back, right about there, where you could hear the words. But what about the difference between a question and a statement? That was on the right side over here. So what happens if I cut out this part of your brain? You wouldn't be able to tell the difference between those 2 sentences. You wouldn't be able to tell the difference between the question versus the statement. And it's this part of the brain that allows you to tell the difference between the 2. All right, let's try something different. I want a different volunteer for this one. All right, in the back, senior. All right, so here we go. Everyone watch this young man on a very difficult task. Are you ready? I don't think you're ready. I want you to stand on your right foot. All right. Now I want you to take your left finger and touch your nose. Now I want you to take your right hand and raise it in the air. So this actually doesn't test anything. I just think it's funny to make people do it. All right, you can sit down. No. So actually, what he was doing, what did he have to do in order to stand there on one foot? What do you have to do? Balance. So where does balance come from? So you need a couple things. One is you need your muscles to fire, but then, did you see him kind of swinging back and forth a little bit? So as he started to go this way, his body said, you're going to fall over, and it had to bring him back to the center, and he went back and forth. That's this back part of the brain at the bottom. Does anyone know what this is called?
It's like some big words.
All right, what is it? Oh, wait, I heard it. Cerebellum. This cerebellum is balance. So if you lose your cerebellum, you can't stand on one foot. You can't walk in a straight line on a tightrope. You have problems with your balance. All right. So now let's stay within movement and sort out how we move things. So this is the left side of the brain. Does anybody here know which half of your body it controls for movement?
Right.
The right. So this side of the brain, sitting in your head just like this, sends signals down to the right side. And right here, this one strip in the brain is where all the cells are for movement. And they're organized so that you have your leg right up here, your arm right here, and your face right here. All the different muscles that get projected to from here. All the cells that are going to my legs, my right leg, live right there. So if I cut out this one part of the brain, what can I move? My right leg. So when somebody comes in and they can't move their right leg, one of the places we look is, do they have a problem in the brain right here? Now, here's a really cool fact about the brain. It does not feel anything. So if everybody here takes one hand and they touch the skin on their other arm and you just poke yourself, can you feel that? Okay, so every time you tap, you feel it. If I were to take your skull off and stand behind you and tap on your brain, you wouldn't feel it. There are no sensory fibers in the brain. We can do brain surgery on people wide awake. So as we open the skull, for that we have to give them medicine because that hurts. But then we wake them up, and they're awake and they're talking. And we can take little instruments and we can poke different parts of the brain, and they will not feel a thing. So let's say we're going in and we need to remove part of the brain, but we want to just take out the unhealthy part and leave the healthy part. We can take a little electrical probe, put it right there, and do a little zap with a little battery. And if it's the part of the brain that controls the right hand, what will they do in the operating room? The right arm will start moving. If we zap the part that controls language, they won't be able to speak to us until we stop zapping. So we can map each part of the brain and what it does with the person fully awake. And so it's a way. Is that cool or gross? Both. Okay, nice answer. I think it's cool. So we can go through and we can map each part of the brain, and what it does is people give us feedback. One of the areas we do a lot of mapping on is the back of the brain. Does anyone remember what this is called? Occipital lobe. Good. Does anyone here know what the occipital lobe is meant to do, what it's dedicated for? It's vision. That's exactly right. So you have, I'm going to set this down, an eyeball right in the front. You actually have two of them. And there's a nerve that goes from your eyeball back to the brain. So as you're looking up at me and my image falls on your retina, on the back of your eye, that light signal gets switched into electrical signals that go to the back of the brain. And it's the back of the brain that then interprets what you're seeing, whether it's light or dark, whether it's a shape. And what happens in the back here is you form the image, and then you have to decide what it is. So if you look at me, you see a human being. If you look at a dog, you say that's a dog. If you look at a cat, you say that's a cat. That information is a connection going up to the parietal lobe. So if I take out your parietal lobe, could you see me? Well, you could see me, but would you know what I am? So if I take out somebody's parietal lobe and I show them a clock and I say, what is this? They won't know, and they'll make up answers. They'll say it's a dog. I'll say, are you sure? And they'll say it's a cat. Are you positive? And they just make up answers because they don't know what it is. If I take out the occipital lobe, can you see? No. So you can stand in front of that person and you can wave your hand back and forth. Even though their eyes are perfectly normal, they can't see anything because the brain connection isn't there. So this parietal lobe is there to figure out what things are, and it's also there to sort out where things are in space. So who wants to be the next volunteer? All right, so stand up. And I'm going to you need a partner. Who are you going to pick for your partner? All right, she volunteered you. So here's what I want you to do. So I want you to close your eyes. And I want your partner, I want you to take her arm, and I want you to either move it way down low or up over her head. Now keep your eyes closed, no looking. Which way did she move your arm? How do you know you didn't see it? You can feel it. You know where your arm is in space. And guess what part of the brain tells you that? It's that parietal lobe. So what would happen if I took out your parietal lobe?
I would be like, left.
You wouldn't be able to know where things are. And you want to hear something really freaky? If I take out somebody's parietal lobe, not only do they not know where things are, but they don't know what things are, and they don't believe that one half of their body is connected to them. So if I take out somebody's right parietal lobe, so let's imagine we took out my right parietal lobe and somebody held up this arm in front of me, I'd start yelling, who stole my watch? I would recognize this is my watch, but I wouldn't recognize this arm is connected to my body. And so it's called a neglect syndrome. That people neglect one half, and they'll come in to the clinic half dressed. They put their right pant leg on and their right shirt, but they don't do anything on the left. They shave the right side of their face, but not the left. They brush their right teeth, but not the left. Because when you lose that parietal lobe, you don't have a sense of your whole body. You lose half your body. So each of these parts of the brain play a very different role, but remember, how many connections were there between the neurons? Anyone remember? There's 100 billion neurons and 1 quadrillion connections. And those all live here to make all these decisions. Yeah?
Can't you see yourself in the mirror?
So that's a great question. So when you go to look in the mirror, with an intact occipital lobe, you can see that there's something in the mirror, but without the parietal lobe, you don't pay attention to the other side. It doesn't mean anything to you as a human being. And here's the interesting experiment we did 50 years ago with patients who had lost their parietal lobe. So imagine this. Imagine I had all of you walk through that door to the center of the cafeteria, looking that direction, and I said, okay, close your eyes, and now describe the room for me. You would all be standing here and you say, well, Dr. Greenberg, there's a stage on my right, there's the lunch line in front of me, there's a wall and tables. You describe the whole thing. If you didn't have a parietal lobe, what would happen? You'd walk into the middle of the room, close your eyes, and you would only describe things on your right side. It would stop right in the middle. And I'd say, is there a wall? Are there tables? And you'd say, I don't know what you're talking about. But here's the really freaky part. With your eyes closed, if I say, now imagine you had walked in from the other side of the room. Just imagine it. Now describe the room. You will now describe everything on the other side of the room. You saw it, the information got in, but without your parietal lobe, it doesn't mean anything to you. It's as if it doesn't exist. Whatever is on that one side of the world doesn't matter to you. It's kind of weird. All right. So who wants to take a close-up look at the brain? All right, so I'm going to get an assist. I brought an extra pair of gloves if you want. I would offer my hand, but you don't.
That's okay.
Those are yours.
I think you were going to
Thank you.
climb up there.
I'm pretty limber. I'm so excited to hold it. So you can, like, what do you want me to do?
Well, if they want to take a look, and I can keep chatting as we go.
Yeah.
So this is, we'll talk about the brain stem
Okay.
here.
Okay.
And I'm going to talk about these parts, which are temporal lobes.
Okay, so-
Okay? And you can take the whole tray if you want.
No way.
It's all
Hold
yours.
it.
All right, so you guys are going to get a close-up look at the brain. Yeah, question. How did you get, that's a really good question, because for years, people said there were just as many cells in the brain as there are stars in the skies. And we kept saying, well, why do we say that? And it was a guess. Nobody ever actually sat there and counted. So a group of scientists a few years ago started counting. And what they did was they took samples and they put it under the microscope. And within a centimeter sample, they counted how many cells. And then they did the math to separate out, to calculate how many there are in the brain. So it was a mathematical formula. Nobody actually has ever sat there and counted every cell. So what you're going to, yes? Yeah. Yeah. So great question. So what happens when you hit your head really hard and you get a concussion? What's happening is those neurons are breaking, and so instead of having 1 quadrillion connections, you now have less. And if you keep getting concussions, you have less and less and less, and the neurons can get sick from the repeated hits, and so the brain doesn't work the way it's supposed to. So now, one of the things Ms. Walsh is going to show you on the underside of the brain is the part that we haven't talked about yet. We've talked about the frontal lobes and speaking and movement. We've talked about the occipital lobes and vision, the parietal lobes and sensation and knowing where you are in space. What was the 4th lobe of the brain that we haven't talked about yet? So frontal, parietal, occipital, and temporal. Somebody got that. Perfect. So good job. So the temporal lobes, one of the key things about the temporal lobe is memory. All right, we're going to do a quiz. Ready? I'm going to say 4 numbers. Let's see if you can remember them. 4, 7, 1, 9. Okay, now I'm going to make it harder. 4, 8, 9, 1, 6.
4, 8, 9, 1, 6.
All right, how many numbers do you think I could say in a row and you all actually remember?
6.
10, 6. Has anybody here memorized pi out to more than 10 digits?
No.
You're out. Who's got the most digits of pi?
I know.
How many do you think you have? 15? How many do you have? 20. All right. This I want to see. All right, let's hear pi to 20 spots. See, I don't know if you're right or wrong, but it sounded good. So how did you learn? How did you learn all those digits of pi? Okay, but as you were competing, how did you actually get more and more? What did you have to do? Did you look at it once? Did you just open a book, look at it, and remember? So has anybody here heard of individuals who have a photographic memory? Yeah. All right. Yeah. And so let's talk about this for a minute. So everybody here has temporal lobes that Ms. Walsh is going to show you on the undersurface. And there are specialized cells in those temporal lobes that are there for memory. Now, if your teacher says you have homework due tomorrow, it's your temporal lobes that encode that information so that late at night you go, oh, wait a minute. Oh, no, I have homework due tomorrow. And you remember at the last minute. That's your temporal lobes. People with a photographic memory, their temporal lobes, they remember everything they read and everything they see. Yeah. So memory is one of the more fascinating things of the brain, because how many people here with their iPhones or iPads take pictures? How many people take pictures? Okay. How many people here, leave your hands up. Leave your hands up if at some point your iPhone or iPad has gotten full and you had to delete things to make more space. It's really annoying, right? Okay. So the hard drive within the iPhone and the iPad is like a little brain. As you remember photos, it encodes them. But what happens when things get full? You have to delete some stuff in order to make room for the new stuff. So some people, and it may be some of you, have a hard drive that can remember lots of things. Other people may have hard drives that can't remember as many things. So as they're learning new information, it's harder to recall the old. Now, let's talk about your guys' childhoods. How many people here have a memory from kindergarten? Okay. All right, now put your hands down. How many people here can tell me everything they had for lunch throughout every day of kindergarten in order? What? Why not? So what was somebody's memory from kindergarten? Somebody who's going to share a memory from kindergarten? No? Sarah, what's a memory from kindergarten?
We had chicks sitting, and I was holding a chick, and it pooped on my hand.
Okay, so why do you remember the chick pooping on your hand in kindergarten?
Because it was absolutely disgusting.
It was absolutely disgusting. So the way the temporal lobes work is as you're having events, it decides what is it going to encode for the long term. So you will always remember the chick pooping on your hand. And it also decides what it's going to throw out. You don't really care if you had a peanut butter sandwich for lunch on the third Wednesday of kindergarten. That's not important information for you. Well, maybe for some of you, but for most of you, it's not important information. And so your temporal lobes decide what is it going to encode and remember and what is it not. Okay. Yes? Yeah. So are there ways to improve your memory? And the answer is yes. So how many people here have had to study for a test this year? All right. Now I'm going to ask the teachers not to pay attention. How many people here had to study for a test for information they were not interested in? Yeah. All right. That's very unfortunate. Not science, clearly. This was LA. This was all LA. So okay. So wait, I'll get to smell in 1 second. Let's finish memory. So when you were studying, hey guys, when you were studying for a test for something you weren't interested in, how did you learn the material? Flashcards. What else? What else do people do?
Made up a song.
Made up a song. I like that. What is it? I can't hear you. Go louder. Quizzed on it. So what all of these things have, so songs, flashcards, quizzed on it, is repetition, repetition, repetition. So if there are things you want to remember, you either have to repeat it over and over with flashcards and quizzing, or you have to come up with a fun way to remember it, and that's where people do singing. So I had a question about the smell. As you guys were getting close to the brain, was there a smell? Yeah, guess what? That's not the brain you're smelling. So it's, no, I hope not. So when we take a brain out of the human body, it's like Jell-O. It's really squishy. And if I had a fresh, live brain and I were to do this to it and squeeze it, it would just liquefy pretty quickly. It's very gooey. So we put it in something called formalin, and we put it in formalin for about 2 weeks in order to get a little more solid so we can handle it. What you're smelling is the formalin. The actual brain doesn't have a smell at all, or it's definitely not like this. So what you're smelling is what we use to fix the brain and not the brain itself.
And that was interesting because a lot of kids were asking, is it squishy? And I guess I was thinking, the one I'm holding, no, it wasn't. You're right.
And so normally it is.
Yeah.
Yeah, and so normally if we do surgery on someone with a brain and we're taking pieces out, it's a little firmer than Jell-O, not as liquidy as Jell-O, but it's in that range.
So I've always, when I think about a brain, I think of like a pink brain. Like, is that what the color is inside the body?
Yeah, I've gotten this question a lot, and I guess I just take it for granted. This is the color of the brain. It's a tan brown. So when we do surgery on a live patient and open it up, this is pretty close to the color. This is a little paler just because of the fixation, but it's in the same range. Now it's not. It's got this color to it. It's got this brown tan color. So when we first take off the skull, there's a piece of tissue, a covering here called the dura. It's like saran wrap for the brain, keeping everything in place. And we peel it back, and then we get to this layer where we can actually see the brain.
I feel like all the cartoons and stuff is pink.
Well, how come in all the cartoons it's pink? Well, also in the cartoons I can drop a piano on their head and they walk away. So the cartoons aren't real. So it's just kind of normal for people to think about organs in the body as being kind of a pink, but actually most of the organs aren't. So lungs can have a pinkish color, heart is red, spleen is red, liver is red-brown, brain is tan, and so it just depends on which organ has a different color. The pink organs tend to have a lot of blood products in them, and that's what makes them pink. Yeah?
Also, if my arm were to be cut off, then would my brain still be able to send signals to my arm, but or would it just not be there?
That is a great question. So what happens when there's an injury to the body, but the brain's intact? So has anybody here for amputees, so you gave the example of an arm being cut off, has anybody here ever heard of phantom limb syndrome? Is that something you've ever heard of? All right. So if you ever have the chance to talk to an amputee, somebody who has lost a leg or an arm, there's a certain percent of them who will tell you, if you ask nicely, that even though their leg or arm is gone, they can still feel it. And what's happening is their brain is processing information that makes it seem like they can feel it, but the limb still isn't there. It all lives within the brain. And we can manipulate that and actually get rid of the phantom limb syndrome. So your brain will think it's still there when it's not and have to relearn things. Just like if you damage one part of the brain. So let's say I damage the part of the brain that's responsible for moving my left thumb. Can I ever move my left thumb again? You would think not, but it turns out the brain can adapt. So it turns out that the brain can figure out that some cells have died and other cells need to reprogram themselves to take over. So with the right therapy, we can train people to move their hands and legs again, even after they've had damage to their brain or spinal cord. Yeah?
So I read this somewhere that we only use 10% of our brain.
Yeah.
But is there a way to kind
Yes. So that figure, we only use 10% of our brain, is a number that gets thrown around a lot. We're not sure it's wholly accurate. The idea is with 100 billion neurons, we think we should be able to do more with our brain than what we're doing. So are there ways to get better memory and better processing? And the answer is yes, but you're not going to like the answer in terms of how. So less electronics, less video games is one way. Do you want to know the most important thing you can do to increase your brain power? Is actually get a good night's sleep every night. So you should be getting, at your age, you should be getting 10 hours of sleep with no interruptions, meaning no electronics in bed, no screens, no nothing. You have a bedtime and a wake-up time. And actually what we found is when cells get that sleep every night, their brain power is better than if they don't. And so, yes, there are things you can do. Yeah? Yeah, so the question was, can you listen to the radio? And the answer is, in general, we say don't. In general, you want a quiet, dark room and train your brain to shut down and go to sleep. Guess what happens when you're sleeping, what the brain is doing? Is it like having a screensaver on your computer? Does it go to sleep? During sleep is when those temporal lobes form new memories. So they did a study years ago. It wasn't in 7th graders. It was in older individuals who had a test. So it was, imagine Miss Walsh coming in today and saying, class, tomorrow you're having an exam, and your entire grade for the year is based on this exam. And she freaked you out. And she gave you a 1-hour lecture filled with really complex information and said, tomorrow your entire grade matters. And then we split you up in 2 halves. And half of you, we said, your bedtime is 9 p.m. And the other half, we said, you can stay up as long as you want. And the ones who could stay up as long as they want spent most of the night studying over and over and over again. Who did better on the exam the next day? The people who reviewed it once and went to bed. So what happens is, and we can study this, is while you're sleeping, you are forming those connections. Those 1 quadrillion connections happen most while you're sleeping for information. Yeah? Okay.
Okay, so I read this article that like if you keep like technology and screen with like within 5 feet of your brain, it messes up with the cells and doesn't allow like the brain like function properly.
Yeah, so there's been a lot of studies looking on like cell phones and iPads. If it gets close to the cells of the brain, can it do damage? There's actually different data. So some studies question whether or not it can. The last one that came out said that it doesn't lead to any cell damage or death. The honest answer is we don't know yet. So we're trying to do as little electronic time as possible until we're sure. Yeah? Headaches. Good question. So do you remember the part of can the brain feel things or not? So if you have a pain in your head, is it your brain hurting? No. So headaches, the pain you feel from headaches comes from either the muscles over the skull or the blood vessels around the brain or that lining around the brain, but the brain tissue itself doesn't hurt. So a lot of people come to us with a headache and they say, Dr. Greenberg, I think there's something wrong with my brain. And I say it's not the headache. It's either the muscles, the blood vessels, or that tissue around it. It's a good question. Yes?
I have 2. One of them is if our brain isn't like thinking of like a time, like what about dreams?
Dreams. Okay. So has anybody here ever had a dream? Let's start with that. Yeah. Did it seem real?
Yes.
Yeah. So when you're asleep, what happens is a certain part of the brain shuts down and then you disconnect from your body. Has anybody had a dream where in their dream they were running? Did you wake up and were you down the block? No. So you didn't actually run or go anywhere because the brain has a shutoff switch to make sure you don't act out your dreams. But dreams are part of the processing. So when you're asleep and you're forming new memories, part of that is done with dreams. Yeah.
If you had a prosthetic leg and someone kicked you, would you feel it?
No. So if you have a prosthetic leg and it gets kicked, there'd be no sensation there. Yeah.
You said that like we don't act out our dreams, but then how come some people like sleepwalk? Yeah.
Why do some people sleepwalk? So remember I said there's a shut-off switch. In some people, the shut-off switch can be broken episodically, so they do act out their dreams. Or has anybody here ever known someone who talked in their sleep? Anybody here ever known someone who walked in their sleep? Yeah. So that's the shut-off switch. If the shut-off switch doesn't work, what you dream, you will act out. Okay. Yeah.
Is it true that if you that you can't die in a dream, and if you do, you die in real life?
Yeah. So there's been this question of whether if you imagine yourself or dream yourself dying, would you die in real life? Turns out that that's not true. Yeah. See, and we have proof right here. Sarah keeps dying in her dreams.
No, it's actually a recurring dream.
Really?
Where I die. Yes.
My recurring dreams were about science tests, not about them. All right. All right, everyone listen up.
Why is this actually dangerous?
Is it dangerous to what? Is it dangerous to disturb to wake up a person who's sleepwalking? It depends on the person. Some people, so you just have to know the person. Some people, if you shake them, they just wake up and they say, who, what, where, what am I doing? And then other people can be confused and get a little grumpy. So it depends on the person. Most of the time, it's safe to do. Yeah. Okay, so the question was, how does deja vu happen? First, does everybody here know what deja vu is? Does everybody here know what deja vu is? Does everybody here? Oh, wait. Okay. I've done this before. I had to. So deja vu, what do you feel like? Tell me what deja vu feels like. What does it feel like?
You've never done something before, but it feels familiar.
Yeah. So has anybody here ever smelled something and you were trying to place where you had smelled it before, it smells similar to something else? Yeah. So that's kind of in the same league. What's happening is your brain is trying to make connections between different memories. And the other thing that goes into deja vu is sometimes you have seen something before, but your temporal lobes didn't encode it into a memory in a really detailed way. So you see a person, you're like, I swear I've seen that person before, and you have, but you didn't encode it in such a way. So deja vu can come from a couple different places. Yeah?
So like, say you have like a tumor in like your brain or something,
Mm-hmm.
and so your brain is like protected by your skull. So what if the tumor keeps growing and growing, like while it's inside of your brain?
Yep.
Will your brain get like damaged and like squished, and then you'll run out of room or something?
It's exactly what happens. So if you have a tumor over here that grows, and grows, the phenomenon called herniation, which is also known as squishing or moving the brain, occurs. And what happens is the normal brain tissue gets squeezed down to the bottom of the skull, and it can also get squeezed into where the spinal cord is going, because this is all connected. It is a dangerous event when that happens. And so one of the things we're trained to do is to recognize people who are having growing tumors or clots in their head so we can get it out and avoid that herniation. But you're exactly right, because the skull is hard, it will push on the brain and cause damage. So, yeah. Why don't you ever? So the question was, why don't you ever remember your dreams? But let's ask your friends. How many people here remember their dreams in the morning?
I remember nightmares.
You remember nightmares. Okay, how many people here don't remember their dreams? Yeah, so it's a mix. Some people remember them and some people not. Yes, Ms. Walsh, 5 minutes, okay.
You know how you said like sometimes it's with your brain and act out your dreams will turn off?
Yep.
And like something was like what if it's broken and your dream like get back?
Yeah.
Could you get back?
Yeah, so the question is, if that switch is broken so that you're acting out your dreams, do people do things in their dreams that they didn't even know they could do or not in real life? And the answer is very rarely, the answer is yes. So there are some people who have been described in their dreams at night to speak languages that they didn't know as well, or cook, or do all sorts of things. Usually it's an action that you know how to do. Yeah. Yeah. How does your brain develop bad habits? That's a great question. So right here, so if I were to take this probe and right in the center go in about an inch, there is a small collection of neurons several 100,000 out of those 100 billion neurons, and they are responsible for forming good and bad habits. They are the reward center for the brain. So, let me ask a question. If this afternoon you found out you had the winning ticket to the Powerball and you had won $100 million, how would you feel? Awesome, right? So that feeling of awesome comes from this group of cells right at the top of the brainstem, and you can associate that with other things. So for people who start smoking cigarettes or experimenting with drugs, things you shouldn't do, because what those chemicals do is they activate those cells, and it makes you feel like you're winning the lottery when you're actually harming yourself. And so for any habit, if it's done in the right way, certain times, good or bad, it'll activate those cells, and you want to do it over and over and over again. Yes?
So with DID or like personality disorder or whatever, like I've watched videos that says like if they have like a trauma early in their childhood, it'll like split up their conscience and they'll have different personalities. And like I watched a movie where it's like each personality or whatever have like their own like characteristics. Like one was super strong and one was like not strong at all.
Mm-hmm.
Like how is that possible?
So when we get into personality changes of the brain, you can't see any difference in terms of what their brain looks like. So if I take out the brains of individuals who have personality changes versus not, looking at it like this, everything looks basically the same. But those 100 billion neurons with the 1 quadrillion connections, the connections are different in different people. And so depending on the types and the numbers and the pattern of connections you have, you get all the different personalities that you have here, because you're all very different. And even in one person, certain connections can take over at different times. And you've experienced this even without having multiple personalities. Has anybody here ever been really angry at their brother or sister, if you had one, or their parents or the teachers? All right. Now, has anybody here who was really angry with their brother or sister or parent or teacher the next day said, you know, I shouldn't have been that angry or that upset? Have you ever looked back and said, so there are, no, never, doubt that. So there are times when certain connections will take over and you'll be very angry, and then in retrospect, other parts of the brain will reevaluate what you thought or what you did. So, one more question. All right. Last question. What causes nightmares? Nightmares are just dreams, same thing as dreams. You're processing information, but your brain has decided to go down a scary path. And we don't know why it necessarily picks a scary path versus a dream where you keep winning the lottery over and over again. And so we don't know why it picks one or the other. All right. There you go. Wait. Good timing.
So, this was an amazing way to introduce the nervous system. So, let's give it up for Dr. Greenberg.
Thank you, guys. Good questions.